Let me begin with something I wish someone had told my own patients earlier in life. Sometimes the very medications we rely on to help us feel better can quietly work against us. In fact, some of the most commonly prescribed drugs for seniors, medications you may have in your bathroom cabinet right now, can speed up memory loss, confusion, and even trigger symptoms that look a lot like dementia. And here's the part that alarms me most. Many people take these medications for years without ever being warned of the risks. Now, I don't share this with you to scare you. I share it because knowledge is power. When you know what to look out for, when you understand which medications may harm your brain, you can take action by talking with your doctor, by asking the right questions, and by protecting your memory and independence. So let me ask you this. Have you ever felt more forgetful since starting a new medication? Or maybe you've noticed a loved one becoming more confused over time, and you're wondering if their pills could have something to do with it. If that thought has ever crossed your mind, I'd love for you to share your experience in the comments below. Your story could help someone else who's going through the same struggle. Now, let's talk about the truth. I've spent years studying how medications affect seniors, and one lesson stands out again and again. As we age, our brains become more sensitive to drugs. The very same pill that might not cause a problem for a 40-year-old can cause brain fog, confusion, or even serious memory decline in someone over 65. Why? Because as we get older, our liver and kidneys process drugs more slowly, our brain chemistry changes, and side effects tend to hit harder. That's why today I want to walk you through 7 of the most common categories of medications that have been linked to memory loss and dementia-like symptoms. I'll explain how they work, why they cause problems, and what safer alternatives you can discuss with your doctor. And please notice what I just said. Discuss with your doctor. Never stop a medication suddenly on your own. That can be dangerous. My goal is to arm you with knowledge so you can have an informed conversation with your healthcare provider and make the best choices for your health. Let's start with one of the biggest culprits. The first group is anticholinergic medications. That's a big medical word, but what it really means is drugs that block a brain chemical called acetylcholine. Acetylcholine is critical for memory and learning. When these drugs block it, your brain cells have trouble communicating. Think of it like turning down the volume on your memory switch. Drugs in this group include certain bladder medications for overactive bladder, some allergy pills, and even medications for stomach acid. Many seniors take them daily without realizing they're slowly dulling their mental sharpness. I've had patients tell me, "Doctor, I just don't feel as clear as I used to." When we looked at their medication list, sure enough, there was an anticholinergic drug right there. The second group that raises red flags is sleeping pills, especially benzodiazepines and so-called Z drugs. Names you may recognize include lorazepam, diazepam, or even over-the-counter nighttime aids. These drugs can make you drowsy, yes, but they also slow down brain activity in ways that hurt memory and concentration. Seniors who use them for months or years often tell me they feel like they're in a fog. And studies show long-term use is linked with higher dementia risk. Sleep is essential, but drug-induced sleep is not the same as natural, restorative sleep. The third group is antihistamines, especially the older, first-generation ones like diphenhydramine, better known as Benadryl. Now you might think, that's just an allergy pill. How bad can it be? But diphenhydramine is one of the strongest anticholinergic drugs out there. Take it for allergies, or worse, take it nightly to help you fall asleep, and you're dosing your brain with a chemical that literally blocks memory. I've seen seniors become more forgetful within weeks of starting daily Benadryl, and the scariest part is many don't even realize it's risky because you can buy it without a prescription. Fourth on the list are certain medications for anxiety and depression. Now, let me be very clear. Mental health is important, and sometimes medication is necessary. But some antidepressants, especially the older tricyclics, also have strong anticholinergic effects. They can dry your mouth, make you dizzy, and yes, blur your memory. Thankfully, there are newer antidepressants that are safer for the brain. but too often, seniors are still prescribed the older ones. The fifth group is antipsychotic medications. These are sometimes given to seniors for behavioral issues, like agitation and dementia or severe mood problems. But here's the cruel irony. Some of these drugs can make memory problems worse, not better. They can also increase the risk of falls, strokes, and even shorten life expectancy in older adults. I've always urged families to be cautious and only use these drugs as a last resort when other strategies don't work. The sixth group is medications for Parkinson's disease. Now, Parkinson's is a challenging condition, and medications are often necessary to improve mobility. But some of the drugs used to manage tremors and stiffness can unfortunately increase confusion and memory loss. It becomes a delicate balance between easing movement and protecting the mind. That's why if you or a loved one takes Parkinson's medications, it's so important to monitor for changes in thinking and talk openly with your doctor about what you notice. And seventh, certain seizure medications. Drugs used for epilepsy or nerve pain, like gabapentin or older medications such as phenobarbital, can have sedating effects. While they may calm nerve activity, they can also slow down brain processing speed. Some people describe it as feeling like their mind is moving through molasses. Now, before you feel overwhelmed by this list, let me reassure you, not everyone who takes these drugs will develop dementia, and sometimes the benefit outweighs the risk. For example, if you absolutely need a medication to control seizures, you must take it. But the key is awareness. If you or someone you love is on one of these 7 categories of medications and you notice increasing forgetfulness, confusion, or brain fog, it's worth asking, is the medication playing a role? Here's what I always encourage my patients to do. Once a year, take every pill bottle you have, prescription and over-the-counter, and bring them to your doctor or pharmacist. Say, "Can you review these with me and let me know if any of them could affect my memory?" This simple step can uncover hidden risks. You might be wondering, what can I do instead if I need treatment but don't want my brain health to suffer? Great question. For bladder problems, sometimes simple lifestyle changes like reducing caffeine or doing pelvic exercises can help. For sleep, focusing on good sleep hygiene, like a regular bedtime routine, limiting screen time at night, and creating a calm environment often works better in the long run than pills. For allergies, newer antihistamines like loratadine or cetirizine are much less likely to affect memory than diphenhydramine. And for mood or anxiety, modern medications or non-drug therapies like counseling and mindfulness can sometimes be safer and more effective. I want you to remember something very important. Your brain is your most valuable asset. Protecting your memory means protecting your independence, your relationships, your very sense of self. You have the right to ask questions, the right to know the risks, and the right to seek alternatives. And let me say this from the heart. If you've been feeling more forgetful, don't automatically assume it's just old age. Sometimes it's not your brain failing you. It's the medication in your pill box, and that can be changed. So my encouragement to you today is this. Take charge of your health. Make a list of your medications, bring them to your doctor, and ask openly about their effects on memory. If something concerns you, don't be afraid to seek a second opinion. The more proactive you are, the stronger your brain will stay. I'd love to hear from you in the comments. Have you or someone you know noticed memory changes after starting a medication? What was your experience? Your story could help thousands of others watching this video. You are not powerless. You are not alone. And with the right knowledge, you can make choices that protect your mind for years to come. I want to take a little more time with each of these medications because I know some of you watching right now may already be taking them. And you deserve to fully understand how they can affect you, not just in vague medical terms, but in real, everyday life. Let's go back to the first group. Anticholinergic medications. These are everywhere. For overactive bladder, you might see names like oxybutynin or tolterodine. For stomach issues, it could be drugs like dicyclomine. Even some antidepressants and motion sickness patches fall into this category. Now imagine this. Your brain is like a room full of light bulbs. Acetylcholine is the electricity that keeps them shining bright. Anticholinergic drugs turn off some of that power. Over time, the room becomes dimmer. That's what happens to your memory and clarity. And the effect isn't just in your head. You might notice constipation, dry mouth, blurred vision, and dizziness. All of these side effects are like red warning flags that your body is being overburdened. I once had a patient, a vibrant woman in her 70s, who came to me worried that she was developing dementia. Her daughter noticed she was repeating stories and misplacing things constantly. When I reviewed her medications, she had been on oxybutynin for bladder control for 5 years. We switched her to a safer option, and within 2 months, her memory was noticeably sharper. Imagine the relief of realizing it wasn't permanent dementia, it was simply a drug effect. Now let's talk more about sleeping pills, the second group. These are some of the most common medications seniors reach for, because sleep problems often increase with age, but drugs like lorazepam, temazepam, zolpidem, or azopiclone don't create real sleep. They sedate your brain, like pulling a heavy blanket over your mind. Yes, you might lose consciousness, but your brain isn't going through the normal cycles of deep restorative rest. Over time, this leaves you groggy, forgetful, and dependent on the pill. Here's something many people don't realize. Long-term use of these medications is linked to falls, fractures, and even car accidents the next day because the sedation lingers. I once asked a patient, "How do you feel in the mornings?" He sighed and said, "Doctor, I feel like I'm wading through mud." That's exactly what these drugs can do. If you've been struggling with sleep, I urge you to look first at non-drug strategies. Going to bed at the same time, keeping your room dark and cool, avoiding caffeine after noon, and using relaxation techniques can make a bigger difference than you think. And if you do need a medication, ask about safer alternatives that don't carry the same dementia risk. The third group, antihistamines like diphenhydramine, is especially tricky because they're so widely available. They're marketed for allergies, for colds, and even hidden inside combination sleep aids. But here's what happens. Diphenhydramine crosses into the brain and shuts down acetylcholine, just like the bladder drugs we talked about earlier. That's why people feel drowsy after taking it. It's not just calming allergies, it's dulling your brain function. Now, imagine someone who takes it every night as a sleep aid. Day after day, they're shutting off a critical brain chemical. Over months and years, this adds up to memory decline. The saddest part is, many people think they're doing something harmless because it's over the counter. Please, if you use diphenhydramine regularly, talk to your doctor about safer options. For allergies, newer medications like loratadine don't carry the same risk. And for sleep, as I said before, lifestyle strategies are far safer. The fourth group, certain antidepressants, requires a lot of compassion. If you're struggling with depression or anxiety, you deserve support and treatment. But older antidepressants like amitriptyline or doxepin are heavy on anticholinergic effects. They can make you drowsy, constipated, and yes, confused. The good news is there are modern alternatives such as SSRIs and SNRIs that are generally much safer for the brain. If you're on one of the older drugs, don't panic. Just ask your doctor if there's a newer option that could meet your needs without clouding your memory. Now let's go deeper into the fifth group, antipsychotics. These medications, such as haloperidol, risperidone, or olanzapine, are powerful drugs meant for serious mental health conditions. Unfortunately, they're often prescribed to seniors with dementia who are agitated or aggressive. But here's the truth. While they may calm behavior in the short term, they can worsen thinking, increase the risk of stroke, and even shorten life. That's why I always caution families. If your loved one is on an antipsychotic, ask why. Is it absolutely necessary? Are there other strategies like environment changes, music, or therapy that could help first? I've seen families work with doctors to gradually reduce these drugs, and the difference in alertness and personality can be striking. The sixth group, Parkinson's medications, is a real balancing act. Drugs like levodopa are critical for improving movement and reducing tremors, but some of the add-on medications, especially anticholinergics like benztropine, can cause confusion and memory problems. This doesn't mean you should avoid treatment for Parkinson's. It means you need to watch carefully for changes in thinking and be ready to adjust the regimen with your neurologist. Sometimes lowering the dose or switching medications can preserve both mobility and memory. And finally, seizure medications. Drugs like phenobarbital or topiramate can be life-saving, but they can also slow mental processing. Gabapentin, often prescribed for nerve pain, can also cause drowsiness and brain fog, especially at higher doses. One of my patients once told me, "It's like my brain is wrapped in cotton." That's a common description. Again, it doesn't mean these drugs are bad. It means their side effects must be balanced carefully against their benefits. And sometimes, alternative treatments or adjusted dosing can make a big difference. Now let's step back for a moment. You may be thinking, "This sounds overwhelming. How can I possibly manage all of this?" Here's the encouraging news. You don't have to do it alone. Your doctor, your pharmacist, even a geriatric specialist, they're your team. And when you walk in informed, when you say, "I'd like to review my medications for memory risks," you're taking control. I always remind my patients, your brain is like a garden. Every healthy habit, exercise, good sleep, staying socially connected, is like sunshine and water for that garden. But harmful medications are like weeds. They choke out growth and vitality. The good news is, weeds can be pulled. You can take steps to clear them out. And let me give you some practical steps you can take starting today. First, make a written list of every single medication you take, including vitamins and over-the-counter pills. Second, circle any that fall into the categories I mentioned. Third, schedule an appointment with your doctor or pharmacist and ask, "Are there safer alternatives for me?" Fourth, never stop a medication suddenly without guidance. That can be dangerous. Always taper under medical supervision. And fifth, keep paying attention to your memory. If you notice changes, don't ignore them. Speak up. I know some of you may be thinking, "But what if my doctor dismisses my concerns?" If that happens, don't give up. You always have the right to a second opinion. Your brain health is too important to be brushed aside. I want to leave you with this thought. Aging does not mean you have to surrender your memory. Yes, changes come with time. But so many cases of dementia are actually drug-induced and reversible. That means you have more power than you realize. If you've learned something new today, I'd love for you to share this video with a friend or family member. The more people know about these risks, the more lives we can protect. And please comment below, which of these medications surprised you most? I read your comments, and your stories truly matter. You are not defined by the pills you take. You are defined by your spirit, your wisdom, your experiences. Protect those, guard them fiercely, and never forget, you are stronger and more capable than you realize. I want to shift our focus now to something even more hopeful. What you can do to actively protect and strengthen your memory, especially if you've been on one of these medications. Because while avoiding harmful drugs is important, it's only half the story. The other half is giving your brain the nourishment, stimulation, and care it needs to thrive. First, let's talk about movement. I know exercise isn't always easy, especially if you're dealing with joint pain or mobility issues. But even gentle movement, like walking around your neighborhood, stretching, or simple chair exercises, has been proven to increase blood flow to the brain. Think of it as turning on the sprinklers in that garden I mentioned earlier. Exercise delivers oxygen and nutrients that keep your brain cells healthy and more resistant to damage. I've seen patients who, after adding just 20 minutes of walking a day, reported clearer thinking and better mood. That's how powerful movement can be. Next, let's talk about food. The brain is like any other organ. It needs the right fuel. Diets high in processed foods, sugar, and unhealthy fats tend to accelerate decline. But diets rich in vegetables, fruits, fish, nuts, and whole grains provide antioxidants and healthy fats that protect your memory. Some people call this the Mediterranean diet, but I simply think of it as eating closer to nature. If you've ever wondered whether your meals could make a difference in your memory, the answer is yes, they absolutely can. Sleep is another cornerstone. We already talked about why artificial sleep from pills can be harmful, but real restorative sleep is like housekeeping for your brain. While you sleep, your brain clears away waste products that build up during the day, including proteins linked with dementia. Without enough good sleep, those waste products pile up. That's why prioritizing a consistent bedtime, creating a dark, cool room, and winding down with calm activities can be life-changing. Now let me tell you about the importance of social connection. One of the greatest risk factors for memory decline isn't just medication or diet, it's isolation. When you engage with others, share stories, laugh, and connect, your brain lights up in ways that keep it strong. If you've been feeling lonely, please reach out to a friend, to a neighbor, to a community group. Staying socially active is just as important as taking care of your heart or your blood pressure. Mental stimulation matters too. Your brain is like a muscle. The more you use it, the stronger it becomes. Reading, learning a new skill, doing puzzles, even listening to music or practicing a hobby all challenge your brain and keep it sharp. I tell my patients, never stop learning. It's one of the greatest gifts you can give yourself. But here's something I want you to hold on to most of all. You are not helpless. Too often, seniors are told that memory loss is just part of aging. But that's not entirely true. Yes, some changes are normal, but rapid, sudden memory decline is often preventable. And sometimes it's as simple as adjusting medications that were never meant for long-term use in older adults. So, how do you take action right now? Start with awareness. Take out a notebook, write down every medication you use, and put a star next to the ones we've discussed today. Anticholinergics, sleeping pills, old antihistamines, tricyclic antidepressants, antipsychotics, certain Parkinson's drugs, and seizure medications. Then, make an appointment. Bring that list with you. Tell your doctor, I've been learning about medications that can affect memory, and I'd like to review mine with you. That single conversation could change the course of your health. And please remember, if you ever feel brushed aside or unheard, you have every right to keep asking questions. I've seen too many seniors blamed for their memory problems without anyone checking their prescriptions. You deserve better than that. Let me share one more story. I once worked with an older gentleman who had been prescribed several medications over the years, one for sleep, one for bladder, one for allergies. His family was heartbroken because he was slipping away mentally. They thought they were losing him. But when we carefully reviewed his medications, we realized 3 of them had strong anticholinergic effects. Slowly, under supervision, we reduced those drugs. Within months, he was more alert, more present, more himself. His daughter told me through tears, "It feels like I got my father back." That's the power of knowledge. That's the power of asking the right questions. I share this because I want you to know there is hope. Even if you've noticed changes in your memory, it doesn't mean it's the end. Sometimes the solution is closer than you think. Now, let's circle back and remind ourselves of the 7 groups to be aware of. First, anticholinergic drugs for bladder, stomach, and other issues. Second, sleeping pills like benzodiazepines and Z drugs. Third, old antihistamines like diphenhydramine. Fourth, older antidepressants with anticholinergic effects. Fifth, antipsychotics. Sixth, certain Parkinson's medications. And seventh, seizure drugs that cause sedation. Each one can dim your brain in its own way, but each one can also be reviewed, adjusted, or replaced with safer alternatives. Your action steps are clear. Review your medications, ask questions, explore alternatives, and focus on lifestyle habits that strengthen your brain. And let me end with encouragement. I know it's not easy to face these topics. It can feel overwhelming to think about memory decline or to confront a doctor about prescriptions. But remember this, Your health is worth it. Your mind is worth it. Every conversation you have, every question you ask, every step you take toward protecting your memory is a victory. I want you to see yourself not as a passive patient, but as an active partner in your care. You have wisdom, you have experience, and you have the right to advocate for yourself. Never let anyone tell you otherwise. So as we close, I want to ask you again, have you or someone you love noticed memory changes after starting a medication? Share your story below. Your words might give someone else the courage to speak up, to ask questions, and to protect their brain health. Thank you for spending this time with me. Remember, your memory is precious. Guard it, nurture it, and never be afraid to demand the care you deserve. You have more power than you realize, and you are not alone.